The Genuine Article. Discussion and commentary based on articles from JACC.
Hi, I'm Tony DeMaria, the editor of JACC, and I'm here with another issue of the Genuine Article. And recently I wrote an editor's page that dealt with the relationship between industry, continuing medical education, and physicians. I've received a lot of correspondence regarding that. I expressed the opinion in that piece that we really needed to be careful about throwing the baby out with the bathwater, that if in fact we eliminated all industrial support from continuing medical education, that in fact we might be left with relatively little education. Now, there's been a lot of reaction to that, and I thought I'd talk about it on this issue. Now, in fact, I think we should be enormously proud of our continuing medical education in cardiovascular disease. We have an enormous amount of new knowledge that's coming forward, and we've developed a program of education so that physicians can stay current and bring the best new developments to their patients. Now, much of this education has been supported by industry. It hasn't necessarily been totally altruistic. Industry, of course, wanted to inform us as physicians, but they also wanted to deliver a message about their product. Now, there's been some concern that the involvement of industry could, in some sense, bias the education, and in fact that's been present almost from the beginning. And so the American Medical Association and the Accreditation Council on Continuing Medical Education have developed guidelines and criteria and now credential and certify CME programs. This clearly has gone a long way toward making sure that industrial support does not lead to industrial bias, but I don't think anyone would be so naive as to say that we've been 100% perfect in this regard. Recently, the government has become interested in this issue, and in fact, the Office of the Inspector General of HHS and the Senate Finance Committee has reasoned that some CME may actually result in physicians using more expensive diagnostic and therapeutic regimens than absolutely necessary and increasing health care costs. And so because of that, the AMA and the Accreditation Council on CME have recently considered proposals to eliminate all industrial support of continuing education. Now, one cannot in any way disagree with the concept that CME should be free of industrial bias, and that the sole determinant of the need for, content of, and presenters of CME should in fact be determined by the educational objectives themselves and not in any way by the sponsors. Having said that, however, it seems to me that it's a bit of a draconian measure to eliminate all industrial support. This might, in fact, reduce the scope and depth of our educational opportunities, and it's not clear that this money would be used for any more worthwhile purpose. In fact, it might be merely promotional. Now, having expressed this in an editor's page, I received a significant number of letters in agreement, but I received a couple that, in a very spirited fashion, actually disagreed and pointed out that, number one, any gift, even small gifts, can be shown to influence thinking even subconsciously and perhaps introduce some bias. Secondly, that many other professions, such as lawyers and accountants, pay for their own continuing education, and that physicians, especially cardiovascular specialists, make a very good salary and really should not need any financial supplements. These are all good points, but I would argue that, in fact, the educational apparatus that we've developed in medicine is more detailed, is more current, and has to deal with greater requirements for continuing education, both on the part of agencies and just merely to keep up with the new knowledge. Secondly, we do pay for a fair amount of our own continuing education. Now, one other point that was made in these letters was that I had not disclosed my own relationships with industry, and in fact, I have a number of them. First of all, I've been a program director, and industry has contributed and sponsored some of my own programs. I've been a program attendee, and I've benefited by industrial support of other programs. And over the years, I've had a number of interactions with industry as a grantee or on the scientific advisory board, or in fact receiving honoraria for lectures. Now, I probably should have disclosed that, and I surely will in all subsequent communications whenever I deal with industry and the profession. Nevertheless, I really don't feel that it has biased my opinion that we have a wonderful CME apparatus in place, that it serves us well to handle all the new evolving information, and it keeps us able to be as well educated as we are. We ought to be very careful that we don't do anything to damage it. I would certainly hope that there is some way that we can avoid industrial bias in continuing medical education without eliminating industrial support completely. For the Genuine Article, I'm Tony DeMaria.
Have a question or comment about a CVN story? Send us an email at cvnfeedback@acc.org.